Hello friend, welcome to the channel Pharmacy Dictionary. In today's class, we are going to study about the further points or we can say further subtopic under pharmacokinetic. These are absorption, and under the absorption we should understand about the first pass metabolism. This is one of those topics which are very difficult for most of the students because this is so confusing. But in actual phase, it is not as confusing as students try to understand this. So in these classes, I am going to make this simplified. So what is first pass metabolism? In this word first pass metabolism having three consecutive words. The first one is first, that means pala, first one. In Hindi first called is first. Then second word is pass, that means movement, passage, and the third one is metabolism. So we have to understand the meaning of metabolism because we have not yet studied about it. In future classes we will be studying about the metabolism in much detail. Metabolism is a process of conversion of complex form to this simple form. There are so many other consequences of metabolism too, like conversion of inactive drug into its active form, conversion of active form of drug into inactive form, or conversion of toxic material into less toxic material, or we can also say that is the conversion of non-polar substance into polar substance so that they may get excreted from our body. So there are so many consequences under the metabolism. But in case of first pass metabolism, the metabolism take place before the drug reach to the systemic circulation, and this first pass metabolism is totally applicable with the only route of drug administration, that is taken through the oral route, or we can say this is applicable for the oral route of drug administration only. In other route like parenteral, topical, it is not applicable because the first pass metabolism is related with the drug which are taken through oral route, that goes for the disintegration, dissolution, and the drug absorption take place from the gut or from the intestine, so that the drug can move from the intestine or gut toward the liver with the help of portal vein, and in this case the drug get metabolized before it reaches to the systemic circulation. So actual metabolism take place after the drug reach to the systemic circulation, then come to the liver. But in case of first pass metabolism, the drug is getting metabolized before that drug reach to the systemic circulation. This is confusing, but you have to listen this if you want to clear it more 100% concept, then you should repeat it again. Now coming to the basic point regarding the first pass metabolism, this say first pass metabolism is a metabolism of any drug during its passage from the site of absorption into the systemic circulation, and that is applicable with the oral route of drug administration. Now let me explain you the meaning of this paragraph. Metabolism of drug during its passage, from where is going to be passed, that is from its site of absorption to the systemic circulation. If I am giving any drug through oral route, the site of absorption is either gut or either small intestine, and from site of absorption to the systemic circulation means moving of the drug from intestine towards the blood vessel or blood stream. So this type of first pass metabolism take place in between these two, that is site of absorption, that is availability of the in systemic circulation. So first pass metabolism lies in between these two terms. So this is called first pass metabolism of circulation, that means systemic circulation. That is why it is also known as or also terms as pre-systemic metabolism. This another word, pre-systemic metabolism, will clear your concept as compared to first pass metabolism terminology. See, pre-systemic metabolism means metabolism which take place before the systemic availability of any drug. The metabolism is taking place before the drug is moving towards the circulation. And towards the circulation, that means systemic absorption. So this is a first pass metabolism. Now see another point which is important one, feature of oral route of drug administration. That means this first pass metabolism is a property, or we can say this specific characteristic feature of those drugs which are taken through oral route of drug administration, because that drug get only absorbed via portal route and that reaches to the liver. By other route of drug administration, this is not possible. How? Because if you are taking the drug via intravenous, the drug will directly be available to the systemic circulation towards the blood flow. So there is no chances of movement of the drug towards the portal vein so that the drug may reach to the liver. That will go to the liver, but after the circulation, that is not considered as a first pass metabolism. So see the process of the first pass metabolism. Drug which you have taken, it could be of any reason. So drug via oral route of drug administration, that drug get metabolized in the gut wall and somehow on the liver before it reach to the systemic circulation. See, before reach to the systemic circulation. So this is called first pass metabolism. Now we have to take a specific note regarding this. So extent of first pass metabolism differ from drug to drug and differ from the individual, that may be from partial to the total inactivation. The process of first pass metabolism is not same for all drug and it is not also same for all individual. The first pass metabolism, or we can say extent of first pass metabolism, may be variable for drug to drug, type of drug to different type of drug, even in for individual with compared to the another one. So what are the consequences of this first pass metabolism? What are the different extent of the metabolism? According to the extent of first pass metabolism, we can classify this into three main categories: low first pass metabolism, intermediate first pass metabolism, and high first pass metabolism. So what are the example of all those which can be placed in this category? To make you better understand, I have plotted a table, or comparative table I must say. So let's have a look at this table, then we will come back to our whiteboard section. Please have a look this table.
So in this comparatively table, I am going to give you the example of drug having various degree of first pass metabolism, starting from low first pass metabolism with intermediate first pass metabolism and finally up to the high first pass metabolism, which is having two more subcategory. These are the drug which should not given orally and the drug which is given by increasing its dose, that means high oral dose. So what are the drug? What are their category? It is very important for you to understand the concept of first pass metabolism, because I am so sure that you have got the point regarding first pass metabolism as definition. So it's time for their respective example with their category. First drug is phenobarbital. Phenobarbital, have you heard about this drug? This drug is used for the treatment of seizure, epileptic seizure, we can say control of the seizure for any patient who is having suffering from this kind of problematic condition. The next example under the low first pass metabolism is phenylbutazone. This drug, that means phenylbutazone, is example of NSAID, that means non-steroidal anti-inflammatory drug. And this NSAID is having property to reduce the rate of inflammation, pain along with the antibiotic activity. That may be variable, but this drug is the example of an SAID category. Next drug is tolbutamide. This tolbutamide is used to treat the type 2 diabetes, a type of diabetes where the proper secretion and optimum secretion of insulin by the pancreatic cell is not sufficient. And to fulfill the demand of insulin, we need to give some oral hypoglycemic agent, and that are used for the treatment of type 2 diabetes. Because in type 2 diabetes, there is deficiency, but in case of type 1 diabetes, there is a complete destruction of pancreatic cell, or we can say beta cell, so that there is no such proper secretion of insulin. We need to give the particular person external source insulin. But in case of type 2, this tolbutamide is useful. Now, next drug is theophylline. This theophylline is used for the treatment of shortness of breath. That means if someone is having problem regarding the breathlessness, then that drug should be given to him. All these drugs which I am going to explain you are the example of those category which is having low first pass metabolism. Next drug is pindolol. This pindolol is a drug of example of antihypertensive category. Antihypertensive drugs are those drugs which are used to treat the elevated level of blood pressure from 120 by 80 mmHg. These drugs are very useful to maintain the proper and normal blood pressure value in given patient. So next drug is diazepam. I am sure that you have heard about this word or this drug diazepam. This is useful in many of the situations, but most importantly, it is utilized under the category of anxiety. That means it is an anti-anxiety drug, anti-epileptic drug. In case of anxiety, it is used to reduce the unwanted and unnecessary excess feeling of fear. But in case of epilepsy, it is used to control the seizure just because of epileptic condition. Next drug is isosorbide mononitrate. It is an important drug under the category of anti-anginal drug, or we can say anti-angina pectoris drug. These are useful for the treatment of anginal pain that is characterized by left side chest pain. So now it's time to understand the example with the respective category of those drugs which are falling under the category of intermediate first pass metabolism. What is the meaning of intermediate first pass metabolism? Let me explain you this term first. See, in the left side you can see low first pass metabolism, whereas in right side you are seeing the high first pass metabolism. So this intermediate first pass metabolism lies between these two words. That means it is not having low first pass metabolism nor high first pass metabolism. These are just between the two terms, low and high. That is why it is termed as an intermediate first pass metabolism. And the example of those drugs are aspirin. Have you heard about aspirin? This is used for the treatment of acute heart attack case or stroke case. It is also used as a blood thinning agent. So next drug is quinidine. It is not quinine, it is a quinidine, which is the analog of chloroquine, anti-malarial drug. But quinidine is not having much property of anti-malarial drug. Specifically, it is used as a anti-arrhythmic drug. Arrhythmia means improper change in the rhythm of heart that may be too fast or too slow. If the rate is too slow, that is called bradycardia, but if the rate of heart is too fast, that is called tachycardia. But in case of both, that is simply considered as a arrhythmia. Whatever it is, either increase or decrease, simply terms as a arrhythmia. So this quinidine is used as an anti-arrhythmic drug. Next drug is diazepam. This drug is used in the case of depression. We can say antidepressive drug. Next drug is nortriptyline. This is also example of antidepressive drug. Next one is chlorpromazine, which is used in the management of nausea and vomiting in case of travel sickness. It is very useful. Next drug is pentazocine. Have you heard about this? This drug is very useful in the management of severe pain. So these drugs are having intermediate first pass metabolism. Next one, metoprolol, example of antihypertensive drug. Subclasses is beta blocker drug, which is also used to control the hypertension, or we can say elevated level of blood pressure. Now we have to study the most important section of this table. These are high first pass metabolism, not given orally category, high oral dose category. So these three terms are very important. Let me explain you those category drug which should not be given orally. Because of their first pass metabolism rate is very high, that drug will not be able to produce that desirable effect. So it is better not to give them by oral route of drug admission. Any other alternative route should be preferred. These drugs are isoprenaline, which is used in the treatment of bradycardia. What is bradycardia? I have explained you regarding the arrhythmia. Rate of heart become too slow, that's called bradycardia. Next drug is lidocaine. Lidocaine is example of local anesthetic. Now what is the meaning of local anesthetic? All those drugs which are used to block the sensation of pain in a reversible manner are called anesthetic. But those drugs which are used to restrict the pain in a particular site of our body or restricted area in a generalized way is called local anesthetic. But those anesthetic which can reduce the sensation of pain in whole body is called general anesthetic. But lidocaine is example of local anesthetic. Next example is hydrocortisone, which is used in the management or treatment of swelling and itching. Next one category falls upon the hormones. This is testosterone. This is used for the sexual dysfunction purpose. If you want to recover the functionality of sexual performance, then this drug or this hormonal drug can be used. Now it's time to see the example of those drugs which is having high oral dose, which need high oral dose to bypass the first pass metabolism. That means to compensate the first pass metabolism, they will not be able to bypass it completely. I have used word bypass just to explain you that we can manage it by compensating the first pass metabolism. These drugs are propranolol, example of antihypertensive drug, as we have seen in earlier cases. Next drug is alprendolol, which is also example of antihypertensive drug. Verapamil is example of calcium channel blocker under the category of antihypertensive, as well as in case of angina pectoris. These two terms are also interchangeably used in case of verapamil. Next one is salbutamol, which is example of anti-asthmatic drug. Next one is glyceryl trinitrate, also known as the trinitroglycerin, example of anti-anginal drug. These need high drug compensatory mechanism for following purpose. Next and the last one is morphine. This is example of analgesic drug. So these are the list of drugs which are categorized as per the category of low first pass metabolism, intermediate first pass metabolism, high first pass metabolism, and under the high pass metabolism there are two more category, or we can say subcategory, which should not be given orally, and drug which is given in a high dose as compared to the usual one. So friend, let's move back to the whiteboard section. Check the description box for the notes of a specific unit 1. Thank you.
I hope that table make your concept very clearly, because that is one of the important table, and from that table there are so many chances of question to be asked in your main examination. So coming back to the whiteboard section, there are two type of inactivation process of all those drugs which go through first pass metabolism. According to their extent, there are two type: partial deactivation or partial inactivation to the total inactivation of the drug. Partial inactivation means a part of drug or percentage of drug get deactivated or inactivated. inactivated. But in case of total inactivation, all those drugs which are taken by oral route of drug administration may completely lose their therapeutic activity. So how will we manage this loss? There are two types. The first one is partial. What is the meaning of partial? Means a portion of the drug getting inactivated. So how can we compensate? How can we manage that efficacy of the particular drug? So can be compensated by giving the higher dose of that drug. That means if I am taking 500 mg of any drug, in 500 mg, suppose 100 mg of the drug is getting deactivated just because of first pass metabolism, then we are having loss of 100 mg. So how can we compensate this mechanism? We will give 600 mg so that the 100 mg will be get deactivated. Still now we can achieve 500 mg. So we can compensate this loss of 100 mg just because of first pass metabolism by adding 100 mg extra dose. That is applicable for only those drugs which is having property or probability to lose their 100 gram of efficacy. This is compensation mechanism. If you're talking about the example, then see nitroglycerin, propranolol, salbutamol are those drugs which can lose their partial activity just because of first pass metabolism. Nitroglycerin is used under the angina, and the propranolol is example of beta blocker that is used as an antihypertensive drug, and salbutamol is a vasodilator, we can say bronchodilator drug which is used in the case of treatment of asthma. So these are important example. Now if you talk about the complete inactivation of those drugs which are taken by oral route of drug administration, and for that case there is no compensation, only except one probability, that you should change the route of drug administration. So that route has to be changed if you want to avoid the first pass metabolism of these specific drug. Example are isoprenaline, hydrocortisone and insulin. If you want to preserve the efficacy of this example, then you should change the route of drug administration. You should not give this drug via oral route of administration. Because if you give this drug via oral route of drug administration, the complete loss of therapeutic value will be occurred. So coming to the next important note, that is another important, bioavailability of the drug increase in the patient of those who having problem in their liver just because of reduction in the hepatic metabolism. If someone is having liver problem and if you are going to give this kind of drug, the partial loss of drug, then the destruction of drug will not be take place because the metabolic side, that is liver, is not working as it should be. That is why the bioavailability will be higher, because there is reduction in the destruction of the drug just because of the first pass metabolism. So that is important note. If someone is having a good activity of liver, then the first pass metabolism will be take place and the efficacy of drug will be affected. But the liver is not working properly, then the rate of first pass metabolism will be slower as compared to the normal one, and the bioavailability will be optimum as compared to the condition where the first pass metabolism is taking place in a good amount. So this was a small introduction regarding first pass metabolism. The table was very important. You should take the note of that table. If you want to download that particular table in the PDF form, just please go to the description box. There are so many PDF available so that you may download it without giving any prices. That all are free for downloading. Thank you very much for watching this video, and the reference for today's lecture is KD Tripathi and Padmaja Uday Kumar. The latest edition of KDT is 8th edition. So friend, that's all for the day. Thank you very much for watching this video. Namaskar.